And welcome back. Well, we're back now on the Morning Blend with our guest, Tom Qualley. Class is in session. That's right. It's Insurance 101 with Sovereign Select.
I like how he taps that on the
tap,
board
tap.
there.
Very Vanna White-esque.
Yeah.
Tap, tap.
We'll get everybody's attention.
Sovereign Select is an independent insurance agency offering a variety of products, but specializing in Medicare supplement plans, Advantage plans, and Part D prescription plans. Tom says the more you know, the more you can save. And do you like rap people on the knuckles if during your class are not paying attention?
I'm not too mean.
Okay.
No, I'm not like a nun.
Okay, yeah.
But education.
Hope that's not offensive.
No, a lot of people who went to the Catholic school, they'll joke about it too.
We'll probably see that.
Yeah.
Oh, man.
But a lot of what you do is education.
Yeah, that's really what we focus on. You know, empowering people to be able to understand what their options are and really make a decision is really the most important thing, because that's going to end up making people feel more comfortable, and when they go home and they talk to their friends and their family and other people or other agents even, they can explain why they made that decision, and they're going to feel more confident in the decisions that they made.
What kind of insurances do you specialize in? We kind of gave a little overview.
Yeah,
right?
We really specialize in a specific niche, and that's from the beginning. From the time I started this company, I wanted to really specialize in this niche and really be the best at what we do. We specialize in individual and small group health insurance, so we do the Affordable Care Act and Obamacare plans, and then we specialize in Medicare. So along with that, we do all types of Medicare supplement plans, Medicare Advantage plans, and Part D prescription drug plans. One of the beautiful things about working with us, one, we're local, we're family run, and every single year we're going to get in touch with our customers and review their policies every year. During an open enrollment period, open enrollment for Medicare is October 15th to December 7th, and we'll talk about the ACA open enrollment period, which is November 1st to January 31st of each year.
Whenever you're here, I always think about the fact that I pay somebody to do my taxes. And the reason I do that, and I think it's very affordable, is because I end up getting a lot more money back. But also, I'm not an expert on tax law, and that's why I have that person. But that's where that's exactly what you do. And there's so much peace of mind for me in having someone prepare my taxes.
Absolutely.
The same would be true of calling you and having you tell me, okay, here's what I need in a health plan. I mean, you're not just saving people money. You're getting them exactly what they need in terms of benefits and coverage, but you're comparing plans, and you know what's new each year, where they might be able to save money, or where they might be able to get more coverage too.
There's a lot of little tricks, and little nuances that can be done. And the experience that we have, I have almost 9 years of experience in this specific industry, in the health insurance industry, along with Medicare plans and individual health plans. That each person that calls us is going to get a custom fit program. So I can work with a person, and no matter what their situation is, whether it's a financial need, a prescription need, health needs, or sometimes we joke because there are certain plans that I say, well, if you're more of a gambler, this is where you're going to go. If you're not, then you're going to go here. And we can really customize a program for each person.
I think that's great. And one of the things right now you kind of mentioned is that the Affordable Care Act and plans are not in an open enrollment period. So.
Correct.
That starts again in what, November?
November 1st.
And what does that mean for someone? So say they know they're going to need a new plan or they want to change a plan. Do they still contact you now, or do they just wait?
I would say call now, because we want to plan ahead. And it's also good for us as a company to be able to understand, okay, we have this many people that we have to plan for, and we know that going into open enrollment, we can actually set a good game plan together to make sure that everybody that needs coverage during that time will receive coverage during that time.
So you'll put them on a call list?
We'll put them on a call list, and we'll have a specific plan of action as far as how we're going to manage all of the customers that we work with and make sure that they get the top quality service and the absolute best product for their situation once we get to open enrollment.
So you do one-on-one consultations,
Yes.
which are, there's no cost for someone to review their plan with you and just see what their options are. You also have these educational meetings where you rap on the chalkboard. No, but these happen.
Nobody can fall asleep during these meetings.
I bet it's very exciting. Why would someone fall asleep? It's the Medicare 101 educational meetings. Here are the dates coming up where you can attend. They're all at 10 a.m. Thursday, August 13th, or Friday, August 21st. You can also go Tuesday, August 25th. Now, to call for an individual consultation, all you need to do is call 262-641. I'll repeat the number, 262-641-4111 to reserve your seat, or you can visit them online at sovereignselectins.com, and their office is in Brookfield.
Yes, and don't worry, I make Medicare and health insurance really exciting.
I believe that.
You do.
I believe that. Thanks, Tom.
They
Thank you,
leave,
Tom.
they're like, I am so energized now.
I love healthcare.
I love health insurance.
Empower people. I like it. Thanks a lot, Tom.